Okay, hi. So I know you're here to understand how we work with our patients on PCOS, polycystic ovarian syndrome. First of all, I don't call it PCOD. I'm not sure why so many people get labeled with this word PCOD. In India, I've seen this term. It stands for polycystic ovarian disease. It's not a disease, but it's not a lifelong condition that you have to live with. It's a syndrome. And what do we mean by a syndrome? It means that different women, different young girls, young ladies experience different symptoms of PCOS in their own life. Maybe at different stages of their life they have different symptoms, or from female to female the symptoms could be different. There could be two women who both have PCOS. One of them is lean, one of them has weight issues. They both have PCOS. One of them has regular periods, one does not. One has acne, one does not. One has facial hair, one has no facial hair but has thinning of the hair. Okay, so there are so many different ways that it can come up. Periods could be, one of the things, but maybe not. So the point to know is it's a syndrome, and the ultrasound findings, you might have cysts on the ovaries and you might not. So basically, there are a total of three things we look at. Do you have too much male hormone effect? Either when we talk to you and listen to your symptoms and examine you, or on your blood test, are there high male hormones? That gives you 1 point. Second is ultrasound findings of cysts, not just one or two cysts, there's a certain number of cysts and size. Okay. And the third is not having 12 periods in a year, having less than 6 periods in a year. If you have any two of these three, we would call that PCOS. Okay, so you don't have to have weight or no weight gain issues, or it's not about the weight. It's about having any two of the three. And maybe you have only one of the three, but somebody's already flagged it and told you, maybe your physician, your family doctor, your gynecologist, your pediatrician. And that's okay, because we would rather work on lifestyle now when you have maybe only one of them, because an expert clinician may already see the pattern and say, look, this will go to PCOS 2 out of 3 or 3 out of 3 if we keep going on that track of lifestyle. So guess what? Let's turn that around to what can you do with your lifestyle. Okay, and again, my philosophy is to work with you from a root lifestyle perspective so that you can have better health with less medication. I'm very qualified to write all the hormone managing drugs that come with PCOS, but my goal is to help you do the lifestyle changes so that you can be on the least amount of medication possible. So let me talk to you a little bit about that. You may have heard some stuff about PCOS, that if I have it, I can't lose weight, or I can't get pregnant, I can't have a family. Some people have been told they better have a family now, even though they're not physically, financially, psychologically, emotionally ready to become a mother. They're being told that it's better they do it now, because they might not have the fertility later. And they put this fear in the patient's mind. Or that once you have PCOS, you're going to have lifelong medicines and there's no way out. There's no really way of reversing it. So if you've been told any of these things, and or you believe they are true, I want to tell you that they are not necessarily true. A lot of it is in our hands. We can do a lot. And there is so many things we can work with you on. So let's go over it step by step. What are the things you can do towards better health with less medication in PCOS?